Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. We're here once again to provide our community with up-to-date information about our response to COVID-19. This press conference is broadcasting on County TV, Channel 20, and the county's YouTube page. This meeting is being interpreted in American Sign Language by Mala Poe. A Spanish language translation is also being produced by Just Communities Language Justice Network and will be available on the county's website and YouTube page shortly after we conclude. I spent the first half of today in operations meetings with our public health professionals and emergency management experts. Many of these people are working 12-hour shifts with no days off. I'm very grateful for their leadership and service in responding to the evolving COVID-19 crisis. The dedicated and caring staff at all our local hospitals are also working tirelessly to prepare to treat the increasing number of COVID-19 patients that are coming in the near future. The County of Santa Barbara has opened a fully staffed emergency operations center to coordinate public and private work to combat the pandemic. The integration of emergency management, public health, and fire and sheriff's department into a single unified command center is going well. I know many of you are very concerned about your own job security and are asking, how will my family pay for food and rent? Yesterday, I spoke with my 24-year-old son and his girlfriend about the fear they are having about their own financial circumstances. They both lost their hospitality industry jobs and are very concerned and fearful about their future. We talked about the need to take things one small step at a time. I explained the first thing they need to do was file for unemployment benefits. This can take some patience right now because the system is jammed with new applications. It's important to be patient and persist. If you cannot get through it first, try later in the evening. I don't have answers to all the financial questions families are asking now, but I do know that help is coming. The federal government has crafted a more than $2 trillion COVID-19 aid package that was just signed into law. This new economic assistance package is unprecedented in scope and reach. It will provide help to small businesses that are trying to hang on. It will increase and extend unemployment benefits for workers who have lost their jobs. For the first time, it will cover part-time workers who were working multiple jobs to make ends meet. There are new loan programs for small businesses that keep their employees on the payroll. Some of these loans will be forgiven with no repayment required. Renters and small businesses in Santa Barbara, Goleta, and the unincorporated areas of Santa Barbara County are now protected from eviction. Other cities in our county will now be covered by the governor's action today, extending eviction protection statewide. Major California banks are extending mortgage payments for homeowners. Federal student loan payments are suspended until September 30th. Federal and state of California income tax payments and filing dates have been extended from April 15th to July 15th. There will be more legislation at the state and federal government levels in the coming weeks and months to help make more people through this economic crisis. These steps won't eliminate the worry we all have for our loved ones, but it will help us focus clearly on the most important task we all share now, stopping the spread of the virus. We all share a common responsibility to prevent the spread of COVID-19 and flatten the curve by taking important actions in our day-to-day routines. Remember to stay home, unless you are running an essential errand, getting some fresh air, or performing essential work that is exempted from the governor's stay-at-home order. If you are feeling sick, you should treat your symptoms at home and isolate yourself from others. If your symptoms get worse, please call your medical provider or the public health clinics. Your doctor will be able to help you over the phone and tell you what to do next. If you must leave your home to purchase food or get medicine, make sure you stay at least 6 feet away from other people. Please continuously wash your hands throughout the day and regularly disinfect high-touch surfaces. All of these steps are necessary to slow the spread of the virus, flatten the infection curve, and preserve our local healthcare system for the sickest patients who require hospitalization. Our community has faced very tough times before. We know how to work together and to take care of each other. We will make it through this very difficult time together. Next, I'd like to introduce Dr. Vaughn De Reynoso, Public Health Director for the County of Santa Barbara.
I'd like to start by thanking Supervisor Hart for your leadership during this unprecedented time. Thank you. Good afternoon. We have an update on the number of confirmed COVID-19 cases. Today, we are reporting 47 confirmed cases in Santa Barbara County. The ages of these new cases range from less than 10 years old to 70s. So of these 15 new cases, 2 are in Santa Maria, 1 case in the unincorporated area of Goleta Valley and Gaviota, 2 cases in Goleta, 9 cases in Santa Barbara, and 1 case in the South County unincorporated area, which includes communities of Montecito, Summerlin, and the city of Carpinteria. Of the total 47 confirmed cases, 31 are recovering at home, 5 are hospitalized, and of the 5, 2 are in the ICU, and 11 have fully recovered. We expect to see these numbers go up in the days to come, and we hope that as they rise, we will continue to see everyone in our community to do their part by staying home as much as possible and by limiting outings to only essential tasks. Thank you for helping us with this effort.
Thank you, Dr. De Reynoso. Next, I'd like to introduce Dr. Henning Ansorg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. As you just heard, we are experiencing a significant uptick in new confirmed cases in the county. This is an expected development given the high infection rate of this novel coronavirus. Fortunately, we have not had any fatalities due to the COVID-19. Again, I want to thank everyone in our community for embracing our efforts in mitigating the spread of this disease. We know that in China, the spread was reduced by 60% through adherence to strict social distancing and travel bans. We are well advised to follow their example. Just today, the CDC has issued a Level 3 travel health advisory recommending that all non-essential international travel be avoided. I urge everyone to stay the course, practice good hand and overall hygiene, in addition to physical distancing, and please avoid all unnecessary commuting. Please stay close to your neighborhood, as this is the best protection for ourselves and our community.
Thank you.
On another note,
Sorry about that.
almost. On another note, I'm very happy to report that the turnaround times for lab results have improved significantly. This helps us greatly in identifying and subsequently isolating high-priority cases and limit exposure to them. Thank you.
Thank you, Dr. Ansorg. Sorry about that. Next up is Suzanne Grimacy with the Department of Behavioral Wellness.
Thank you, Supervisor Hart. We continue on our journey with navigating a path which none of us has ever traveled on before. We are learning to adjust to the concept of social distancing, physical distancing only, in the community, in the grocery store, on walks outdoors, in conversations with children. As said before, social distancing does not mean social isolation and really is a way that we can learn to reconnect even stronger than before, a time to reset. In my personal life, I have seen more people out walking their dogs, walking or riding bikes as family, more than ever before. And the mood seemed to be more uplifted. Waves of hello from afar are abundant. People look happy. I have seen pictures of teenage Zoom birthday parties where a large group of friends are still able to share important occasions together. A personal shout out to the staff at Mission Terrace who have graciously taken their time to help my mom with her phone so I can see her and she can see our family face to face. I have seen pictures of baskets of food being delivered to people who are isolating at home due to illness. I have seen amazingly creatively choreographed fancy foot greetings as an alternate to hugging or shaking hands. I see our community in a good place, a place of caring for others and for ourselves. This really is a time for all of us to reset. I'm sure many of you have seen the video of the penguins wandering around a closed and empty museum. They're wandering around curiously exploring, and I think we're seeing more and more stories of this, of animals that are coming out. It's really a time for all to reset. Some tips on things we can do to take care of ourselves as we enter the weekend: limit media exposure, get outdoors, manage the uncertainty of what's going on by staying in the present. Keep your routines as best you can, or build new ones, but think of routines as a friend. Be compassionate with yourself and others. Keep looking ahead. This time will come and go faster than any of us will come to believe. Keep being creative and keep connecting. And enjoy this time of reset while individuals within our community heal, while others are kept safe from illness, and while together we regain our balance overall. The Community Wellness Team remains available for the community and has resources that are developed virtually and available countywide. To be connected with the resources available through the Community Wellness Team, please visit the website at sbccwt.org or call 805-364-2750. We are all in this together, and we will make it through this together. Have a wonderful weekend.
Thank you, Suzanne. Next, we'll take questions in the room here. Mr. Fish from KEYT.
Yes, after yesterday's press conference here, Santa Barbara Cottage Hospital released their own COVID-19 patient numbers about an hour after this press conference, and that seemed to confuse some people in terms of having your numbers come out and then a different set of numbers come out shortly after. Were those numbers from Cottage included in your numbers, or was it something, just new information released later? I know you're working with the hospitals in the county, so just some clarification on why that wasn't released at the same time.
So our numbers are released once we verify the lab results and once we've done thorough investigation. So I'm not sure about the Cottage numbers.
There will be a difference in timing and pace of the release of numbers depending on who is giving that information. The county's using a consistent protocol for releasing numbers. Mr. Dreyfus with the Santa Barbara Independent.
With the increase of tests being done, or the fast turnaround time, has Santa Barbara County received more tests available for people to get tested, or are we still at the same 1,800 mark where we were before?
I'm not sure about the exact number that's available every day, but I do know that testing is done at multiple sites, and more commercial labs are coming on board. At the moment, we still have to prioritize the testing to the sickest, to healthcare workers, to residents in nursing homes or other congregate settings.
And when do we think like we're going to have enough tests for everyone in case, and at what point do you test someone who's sick, who doesn't meet that threshold of special people that can get tested?
Okay. The question was, when will there be tests available for large-scale testing in the community?
Well, I wish that was the case already, and I do know that different testing platforms are being fast-tracked by the FDA, and they're coming on as we speak. So I'm anticipating a significant increase in testing that can be performed as of next week already and the time after.
And the best advice remains the same, that people who have symptoms should stay home, just like everybody else is, and that you should assume that you may have the virus, but your best course of treatment is to stay home and manage your symptoms. If they progress to the point where you're concerned, contact your medical provider, and they will give you additional assistance and direction. Mr. Fish.
Dr. Ansart mentioned increased turnaround time, and that being some good news. Could you just expand a little bit more? What was the turnaround time typically you were seeing, and what is it looking like now, and why is that helpful?
And I think I have to repeat the question for the audience. The question was, you mentioned that the turnaround time for testing has shortened to provide a quicker result faster, and what is the prospects for that going forward? Is that going to help in this effort?
The difference that we're seeing now that's better than it had been.
And the rest of the question was, can you compare the time differences from the previous system to the current system?
We do have the ability to get 24 hours or less turnaround time in very high-profile situations. For instance, a nurse getting sick in the ICU or something like that, like really high-priority cases, where we send it to our neighboring county, Ventura Public Health Lab, and they provide us some resources that way with a very fast turnaround time, which is really helpful because it's important to identify people who might, if not identified soon, make other people sick, and isolate them appropriately and not inappropriately. So we have a priority tier system, and then commercial labs have really increased their capabilities. They have, for instance, Quest has opened up more lab sites, as did LabCorp, which are the biggest players in the country. LabCorp is working out of Phoenix now, has a much bigger range of daily testing they can offer. And they are still working on their backlog because when they started off, they had very little capabilities compared to now. And that is the reason why we're seeing a significant improvement also in the turnaround.
Any other questions here in the room? Yes, Mr. Fish.
Just had one last one. Governor Newsom today in a press conference says he anticipates this state to see a surge in the hospitals in the next week or two. Locally, Santa Barbara County, do you have a similar projection in terms of when we'll see that surge?
The question was, Governor Newsom announced today that he expects the state of California to experience a significant surge in patients at the hospital over the next 1 to 2 weeks. What is the prognosis here locally for that patient surge?
So surge capacity is something that we are doing with our community partners, with our hospital partners. So as a matter of fact, we have been doing some rough estimates, and we have a huge surge planning meeting this weekend. So early next week, we should have a model to share.
One last question.
Mr. Dreyfus from the
Yeah.
Independent?
At what point are we going to go to like a hard lockdown where everybody should stay in their house for at least 14 days, and only super essential people available to go out?
The question was, at what point are we going to go to a hard shutdown where only essential people can go outdoors? And I think the answer to that question is that we are hoping that the public listens very carefully to our request to follow the order that the governor issued to stay home. It is having effect. Everybody who has been out running an errand, getting shopping done, or going to the pharmacy can see that there is much less traffic and business going on. Every day, businesses that had not been complying with the shutdown order have been contacted and are being educated about that and are closing their doors. So we are making significant progress with the strategy that's in place, and I expect that to continue. If there aren't any other questions in the room, we'll go to we don't have phone calls? Okay. So that concludes our press conference today. Thank you for joining us. Our next scheduled press conference is Monday at 4:30 in the afternoon. For more information on COVID-19, you can always call 833-688-5551. The number is on over my shoulder. This is the public health call center number. It's open from 9 to 6 p.m. And the website is also available at publichealthsbc.org. publichealthsbc.org. Thank you again for your attention and your presence today.